1 in 4 pregnancies ends in miscarriage. Read that again. 1 in 4. That means if you are sitting in a room with 4 pregnant women, statistically, one of them will experience a pregnancy loss. It is one of the most common complications in pregnancy, and yet it is treated like a secret, like something shameful, like something women should process quietly and move on from. Today, we are going to change that. We are going to talk about miscarriage openly, medically, and compassionately, because silence has never helped anyone heal. There are words that stop time. I'm sorry, there is no heartbeat. For millions of women every year, those words arrive without warning, in a routine checkup, in an ultrasound room, in the middle of an ordinary Tuesday. And in that moment, the world becomes a completely different place. Miscarriage is a loss that is invisible to most people around you. There is no funeral, there is often no acknowledgement. People say things like, "At least it was early," or "You can try again," not because they are cruel, but because they don't know what else to say. But for the woman and for the family, it is a real, profound, devastating loss. Today, this video is for every woman who has been through it, for every woman who is afraid of going through it, and for every person who wants to truly understand what miscarriage is, why it happens, and what, if anything, can be done. You deserve real answers. Not silence, not shame, real answers. Let's start with the basics. A miscarriage, medically called a spontaneous abortion, is the loss of a pregnancy before the 20th week. Most miscarriages happen in the first trimester, within the first 12 weeks of pregnancy. There are different types. An early miscarriage happens before 12 weeks. A late miscarriage happens between 12 and 20. A missed miscarriage is when the embryo stops developing, but the body hasn't yet recognized the loss. There are no symptoms, and it is often only discovered during a routine scan. A recurrent miscarriage is when a woman experiences 3 or more consecutive pregnancy losses. Each type is a different experience, but all of them are real. All of them deserve care, and none of them, none, are simply something that happens that a woman should quietly accept and move past. This is the part that surprises most people. Miscarriage is far more common than most of us realize. Approximately 10 to 20% of known pregnancies end in miscarriage. But when you include very early losses, ones that happen before a woman even realizes she is pregnant, some estimates suggest the number could be as high as 1 in 3 pregnancies. That means this is not a rare event. It is not an unusual tragedy. It is a reality that touches an enormous number of families, quietly, painfully, and often without any public acknowledgement. The reason many people don't know how common it is because we don't talk about it. Women don't share it. It becomes a private grief, and that silence makes every woman who goes through it feel alone, when in reality, she is anything but. This is the most important part of this video, because understanding why miscarriages happen is the first step toward removing the guilt and blame that so many women carry. The most common cause of miscarriage by far is chromosomal abnormality. In fact, approximately 50 to 60% of all first trimester miscarriages are caused by chromosomal problems in the embryo. This means that during fertilization or the very early cell divisions, a genetic error occurred. The resulting embryo is not viable, it cannot develop into a healthy baby, and the body, in its wisdom, recognizes this and ends the pregnancy. This is not caused by anything the mother did. It is a biological process, a natural response to a pregnancy that was never going to continue. Other causes include hormonal imbalances, particularly with progesterone, the hormone that supports early pregnancy. If progesterone levels are insufficient, the uterine lining cannot sustain the embryo. Problems with the uterus can also cause miscarriage. A uterine septum, a wall of tissue dividing the uterus, fibroids, or an abnormally shaped uterus can prevent a pregnancy from developing properly. Infections, certain bacterial and viral infections during pregnancy, can also increase the risk of miscarriage. And in some cases, blood clotting disorders like antiphospholipid syndrome cause the blood to clot in ways that affect blood flow to the placenta. These are medical causes, biological causes, not lifestyle choices, not emotional states, not things a woman brought upon herself. While miscarriage can happen to any woman at any age, there are certain factors that increase the risk. Understanding these is not about creating fear, it is about being informed and seeking the right care. Age is one of the most significant risk factors. As a woman ages, the quality of her eggs naturally declines. For women under 35, the miscarriage rate is approximately 15%. For women between 35 and 40, it rises to around 20 to 35%. And for women over 40, the risk can be as high as 50% or more. This is directly related to the increased likelihood of chromosomal abnormalities in older eggs. Previous miscarriage also increases risk. A woman who has had one miscarriage has a slightly higher risk of another. After 2 or more consecutive pregnancy losses, called recurrent miscarriage, the risk increases further, and medical investigation is strongly recommended. Certain medical conditions raise risk significantly. These include uncontrolled diabetes, thyroid disorders, polycystic ovary syndrome or PCOS, autoimmune conditions, and blood clotting disorders. Many of these conditions are manageable with the right medical care, which is why early diagnosis and treatment matters so much. Lifestyle factors do play a role, though a smaller one than most people assume. Smoking, heavy alcohol consumption, and illicit drug use are associated with higher miscarriage risk. Obesity is also a factor, as it can disrupt hormonal balance and increase inflammation. And previous uterine surgeries or infections that have caused scarring can affect a pregnancy's ability to implant and develop. Knowing the warning signs of miscarriage can help a woman seek medical attention quickly, and in some cases, prompt care can make a difference. The most common symptom is vaginal bleeding. This can range from light spotting to heavy bleeding. It is important to note, not all vaginal bleeding in early pregnancy means miscarriage. Many women experience light spotting and go on to have healthy pregnancies, but any bleeding during pregnancy should be reported to a doctor immediately. Cramping or abdominal pain, particularly if it is significant or worsening, is another warning sign. Some cramping in early pregnancy is normal, but severe or persistent cramping, especially combined with bleeding, needs immediate medical evaluation. Other signs include the sudden disappearance of pregnancy symptoms, nausea, breast tenderness, fatigue that were previously present. This can sometimes indicate a missed miscarriage. A feeling that something is wrong, a mother's instinct, should never be dismissed. If you are pregnant and experiencing any of these symptoms, please do not wait. Contact your doctor or go to your nearest hospital. Early evaluation gives the best chance of understanding what is happening and getting appropriate care. This is the question every woman asks, and it deserves an honest answer. The truth is, many miscarriages, particularly those caused by chromosomal abnormalities, cannot be prevented. They happen at the cellular level during fertilization or early development. No amount of rest, nutrition, or care can change a chromosomal outcome. But there are things that can meaningfully reduce risk, and they're worth knowing. Managing underlying health conditions before and during pregnancy is one of the most important things a woman can do. Women with diabetes, thyroid disorders, PCOS, or autoimmune conditions who receive proper treatment before conception have significantly better pregnancy outcomes. That is enough. That is everything. Thank you for watching. Please share this video with someone who needs it. And if this topic has touched your life in any way, you are welcome to share in the comments. This is a safe space. You will not be alone here.